Hello, my name is Maria and today I will demonstrate the Foley catheter. And before we start, I have to check the doctor's orders to see what the doctors will recommend and see if it's any problem with the narrowing of the urethra, and to see if it's any other special indication for the patient. And I double check, and then I will wash my hands. And here's the wash my hands. I wash my hands. I enter in the patient room. I will provide privacy, introduce myself. My name is Maria, and I will be your nurse for today. And may I have your boundaries, please? Oh, okay. May I have your date of birth and your name, please? Okay. Oh, your name is Mrs. Honey. Oh, nice to meet you, Mrs. Honey. Okay, the date of birth. Do you have any allergies to iodine or shelves? No? Okay, great. Well, the doctor recommends that we'll put a Foley catheter today because you have urinary retention and a little bit discomfort in your abdomen. And are you okay with that? Yes, good, great. Do you mind if I palpate your bladder to see the distension and see the discomfort? No, okay. Well, let me palpate your bladder. Okay, and I'll palpate, or I'll use a bladder scanner. Okay, okay, okay. Well, I will go to prepare all the materials which we need, and then I'll be back and we'll start the procedures. Okay. Okay, I will have the material. I will have the kit for the Foley catheter, and I have to double check to be sure that everything is intact, that it's no damage, water damage, and everything is ready to go, which is good. And I have to double check the size which the doctor recommended. Okay, and I will have even the expiration date, and I have the number of the Foley catheter, and everything is ready to go. And I should have a light if I want to see the meatus better and to observe it. I have the light here, the tape to secure the catheter on the leg of the patient, and I have warm water with soap and with a rag to wash, and I have a bunch of gloves here, and I have some towels and some blue pads to put under the patient, and of course I have the hand sanitizers here. Okay, well, I have all the material here. We are ready to go, and let me put the gloves on. Okay, and I will bring the water and the light close to the bed, and I have here, and I will pull the sheets and the towel, the blanket from the patient, and put it beside the patient. I cannot put it here at the end because you may not be able to see everything what I do. For example, I'll put it in one side and lift up the gown, and I will ask the patient to flex her legs. And do you mind if you flex your legs? And I should raise the bed to a comfortable position, but my bed is not able to be raised. And of course, if the side rails are up, I should put them down as well. And the best way is to let the patient to be on supine position. They can have a pillow under their head and will be fine. And I will just flex her knee just in a comfortable position, and in order for me to see the area. And I will take the pad and put a blue pad under the patient, and of course ask her to lift up her buttocks to be easier to insert the pad. And if it's an older lady, we should put a towel under her buttocks to lift her up, and will be easier for us to introduce the catheter, and which I will place the towel will be easier for me. And of course everything nice and neat, ready to go, and lift up her gown, and everything it's ready to go. And of course I can ask about the allergy to the soap, and I have the soap in the water. Rinse very well and put it on my hand, around my hand, wrap it around my hand, and make it a nice towel. And with one hand I will expose the meatus and the labia. And what I need to do, I need to clean the far labia, and clean it well from front to back. Clean it, and then I will rinse the towel, and then I will come and rinse the labia. Then I will wash it properly, and then rinse the near side. Rinse it wash it first, then rinse the towel, and then rinse the labia, and then the last time will be in the middle where the meatus. And then I should observe very well, wash it well, and then rinse the towel and rinse it very well. And then I have the light here, and I can take the light and just observe the meatus to be sure that, okay, I visualize it very well. And then I'm done, and I can cover the patient, and I will take the gloves off, the dirty gloves, and what I will do, put them in the trash. I have a trash here beside the bed. I put it between the bed and the camera, and it's there. And I'll remove this because I don't need it anymore. Put it aside. And now, of course, I have to wash my hands. Wash my hands. Okay. And organize the table to be free, that I will have all the table nice and neat. Okay. And now I'll open the package. Okay. And I'll take the package out, okay, and put it on the table. And put it on the table, and this can go in the trash. And with this bag, what I can do, I can put the trash beside the bed and collect the trash in it from when we do the catheter inside. And now I would like to wash my hands one more time. And now I will open the sterile package, okay? And I should open it, the one away from me first, and I'll take it and put it away from me, okay? And then I will do the sides, okay? Okay, and then do this one, and then the last one will be the one towards me, and I will take it very careful from the edge and bring it down. And now I would like to, I don't like to have it running from the table. I will just straight it. Good. Okay. And now what I have to do is to kind of like a crane to take out the drape and the sterile gloves, okay? And I want to be sure that I have space on the table, and I will crane and take all the sterile one with the gloves, with everything together. And I'll take them and I'll put them on the table, okay? And I will have the rectangular drape, and what I have to do is to see which side is the shiny side, and that will go towards the patient, the shiny side, and wrap it around my fingers. Okay, I'll wrap it around my fingers, and then wrap it around my hands, and I'll come and try to put it under the patient. Very nice. Okay, and of course expose the private area. Okay, and now I have to put the sterile gloves on, and I would like to wash my hands again. Okay, and now I have to put the sterile gloves, and by the way, I don't need this, and I can put it aside. I don't really need it anymore. And in order for you to see how I put the gloves, I will come closer to here, and I hope that you'll be able to see me. And open them gently, the cuff to be towards me, and be sure that I keep them sterile. And I'm not sure if you see me, maybe you'll see better here, and I'll come back here. And I will open it very careful. Okay. Okay, open here. And be sure that when I open the gloves, I will not open them on top of the sterile field either. Okay, and then I'll open this. Okay, and I'll put the gloves, the sterile gloves, and take them by one, and put my finger in. Okay, this is sterile, and then I'll put the other hand, take them by the cuff and put them in. Okay, now this is sterile, should not go below my waist or above my shoulder. Then now I can take this off, and now I can put the hand on the package because are sterile, okay? And I have the package. And be sure that I'll not put it, keep the 1 inch sterile around. And what I'll do, I'll take the iodine, remove my utensil away, and put the put my iodine over the swabs, and I put it in, which is good. And then what I don't, the trash, I'll put it in the trash. Okay. And then I have the lubricant. Okay. And this is the lubricant, the green color. And I will open it, and I'll put the lubricant here onto where was the syringe with the lubricant to get ready. And then this one goes in the trash as well. Okay, and now I will take the top of the tray and put it beside, but I want to be sure that I protect that 1 inch, that everything will be sterile. And as I see it, and I'll take the syringe, this is with the sterile water, which will go in the balloon, and put it beside. Good. And now I will take the cover, the blue cover from from the catheter, and be sure that I will keep it sterile all the time. Okay, and this is trash, and I have a trash here beside me, and I can put it in the trash. And then this one, I will take the top, and I will put it in the trash, and then I will take and connect it to the green outlet here, and just leave it like that. Connect it very well to be sure that you're not put the water, that you can put the sterile water inside of the balloon, and put it inside nicely, and then take the tray back and put all the tray in the middle. And now take it very careful and bring it to the patient bed. And I'll take it very, 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 very careful, okay? And bring it here. And be sure that you maintain that 1 inch sterile area, okay? And I will move the tray a little bit further, and I will make sure that I will not pass over the 1 inch. And then the top of the tray, I'll put it beside of this big tray, which is perfect. Everything is sterile, and now with one hand, I will put on the labia of the patient to see the meatus and to do a good cleaning with iodine, okay? And are you okay? Everything is okay? Yes, okay, great. And now I'll put a hand and separate the labia, and then with the forceps, I will take the gauze with iodine and clean the labia from me first, from front to back. Clean it well and come around, and then as I need to throw it away, just come around, don't go over the sterile field, and put it in the trash. And now I'll take the second swab and clean the near side of labia, near to me, and clean it from the front to back, nice. And then come over and dump it. Then I will take it again, add the swab, until I will finish all the swab, and clean it in the middle, the meatus, from front to back, okay? Okay. From front to back, clean it very well. From front to back. Okay, and throw it away. And I finish, and I can dump it in the trash. Okay, and now that hand has to stay there all the time. Now with my one hand, I will take the catheter, and when I hold it, I have to be sure that I don't hold it too close, because we'll go inside, and I don't want to my hand to reach the meatus in order to be contaminated my hand. Okay, then I will dip it in the lubricant. Okay, and then it's very hard to keep it, but I'll keep it sterile. Okay, and now I introduce slowly, slowly, slowly. And as I introduce it slowly, I will walk with my fingers backwards, okay? And then when I see the urine coming, by the way, I have to check to be sure that it's not clamped, the tube, to see the urine coming through, okay? And when I see the urine, I stop, and the hand, which was separated the labia, will come and will hold on the catheter 1 inch or even 2 inches from the labia, okay? And be sure that the hands will not touch each other. Then I will take the syringe, the sterile water, and inflate the balloon slowly. And then after I'm done, I have to check to be sure that the balloon is inflated and the catheter will not come out, okay? But only after I finish inflated all of it. Okay, good. And now I will bring it out. Oh, great. It's inflated. Very nice. And now I will try to push it back. Push it back. Okay, I push it back, and now I'll disconnect it. Okay, and I'll put it in the trash. And now I will take all this out and put it on the surface here. And this will go in the trash as well. And I will take the gloves off. Okay, and put them in the trash. Okay, I will wash my hands. Wash my hands. And I will put clean gloves. I will put clean gloves. My hand is wet. I need to wait a little bit. And put the gloves on. And now what I will do, I have a tape, and I want to secure the catheter, the tubing, and should be above, on top of the legs of the patient, and the bag should be tied to the bed frame, not to the bed rails, to the bed frame. And that is what I'm planning to do. Take the tape and tape the tubing to the leg, to the patient leg. Okay, and then this one I will put it beside the bed, on the bed rail, tie it up, not on the floor. Should not be, never should be on the floor. And put it here beside. Okay, I tied it, good. And then I will remove everything. I'll put it in the trash, things which goes in the trash. Okay, and then the towels should be in the dirty linen. Okay, cover the patient nicely. Put it in the dirty linen basket. You can, this one goes in the trash. Put it in the trash. And tell the patient to straighten their legs and make them comfortable. Put the sheets, the blankets. Do you want me to put the bed to the lower position and make the patient comfortable? Do you want me to lift up your head? Yes. Okay, we'll lift up your head. Okay. Put the toiletry, put the bed light near the coal light as well. And I should do some teaching to the patient, tell her that if she needs to get out from the bed to let us know, because she has the catheter, and she should drink enough fluids in order to avoid any urinary tract infection. And if needs anything else, just to call us and we'll come to assist her and to help her. And do you need anything else? Okay, be sure that I'll put the bed light, the table near to her with the water, with her reading materials, and anything she needs it. Do you need anything else? No. Okay, great. And I'll take the gloves out. And be sure that I will clean everything, and that I will document if the patient helped us, if the insertion went easy and smooth, and the urinary, the color of the urine, what was the color, and of course later on will be the urinary output as well. Okay, do you need anything else? No. Great. Have a good day.